Hi, this is Stephanie Rodenberg Lewis with Type 1 Talk Therapy, and today we're going to be discussing navigating a mental health crisis with Type 1 diabetes. If you or your child is experiencing a mental health crisis, you may be at a point where you feel unable to keep yourself or your child safe. You know that you need to do something to intervene in order to ensure their safety. This typically happens when an individual is expressing suicidal ideation, plan, or intent. A mental health crisis requires immediate attention. Here are a few factors to consider when navigating a mental health crisis with type 1 diabetes. First, many mental hospitals are not set up for type 1 diabetics. Of course, we deserve the exact same care and treatment as non-diabetics. However, many psych hospitals turn away type 1 diabetics due to what they perceive to be a liability. If you are considering a psychiatric hospital, call ahead and specifically ask about their policy on medical acuity clients. Next, you will most likely have to turn over your insulin pump. If you're being admitted for suicidal ideation or another mental health crisis, be prepared to go back to injections during your hospitalization. This is a safety factor, as the person with type 1D must be monitored by a nurse when administering their insulin. Next, expect that your blood glucose control will not be optimal. Your primary focus while at an inpatient mental health facility will be stabilization. Inpatient hospitalization is typically around 7 to 10 days. You will most likely be started on medication, which may also affect your blood sugar control. And again, the focus is on the immediate need of safety for the patient. Keep expectations realistic that your blood sugar control may not be what you're normally used to. Finally, bring your insulin and blood glucose supplies, but be prepared to turn them in. As I mentioned above, some hospitals are simply not set up for type 1 diabetics. As such, bring your supplies with you for checking your blood glucose as well as your insulin. The doctor will have to write orders for your injections, and if there is a lag, you want to be sure that you don't miss an injection of insulin while you're waiting, particularly if you happen to be admitted in the middle of the night. And finally, be prepared to advocate for your medical needs. As stated above, the primary focus is on your physical safety, and the specialization of the medical personnel is psychiatry. Therefore, be prepared to explain your needs to staff, and if at all possible, ask your endocrinologist to call and give orders to the prescribing physician on staff. Navigating a mental health emergency is scary. And of course, type 1 diabetes should not prevent you from getting the help that you need. But having the right information is key and can help you be better prepared for some of the challenges. Thank you so much for watching. Again, this is Stephanie Rodenberg Lewis with Type 1 Talk Therapy. I have been living well with type 1 since 1984. I'm also the mom to a type 1 and a licensed therapist. See you next time.